Hi everyone, this is Ryan Hoyme, Director of Social Media for Bombatel. And today we have Boris Prilutsky. Hi, welcome Boris.
Hi, Brian.
Yep,
Happy to be here with you.
thanks. And what types of massage are you practicing currently?
For the last 40 years, I'm practicing medical and sports massage as it was proposed by Russian physician Professor Sherbak. Yeah,
Okay,
please.
yeah.
Yeah,
So you've been doing massage, I mean, did you started over in Russia then?
yeah, yeah. I graduated from special program where degree program where they used to prepare us to work with Olympian teams, and this is what I did. 20 years I did of my career. I worked with Olympians.
Oh, so
Yeah.
you've been working with Olympic teams and stuff like that. So is that totally different than the average public, would you say?
They are. They people of different physiological potential. The overload at the time of the practice is enormous. For normal people, it's not applicable. Let's say it this way. And of course, body built different type of injury side effects of vigorous exercise. All this stuff they are different than the regular general population, no doubt.
So you've been doing massage all your life, basically, then, right?
You know what? Yeah, yeah. Practically from age 21, probably 22, something like this. I even don't remember. I was second year in grad school when I started.
Okay. So you've probably trained many professionals then throughout your careers then too, right?
Oh, you know what? Europe and America, approximately. I was involved in education, approximately 8,000 students. Yes.
Wow, 8,000. Well, that's a lot of students. Can you remember them all by name then, or?
Uh, you know what? Not. But Michael Krongaus, he's the president of this. He from Crash, my student. He's the president of the European Association of Medical and Sports Massage. I'm very proud.
Yep.
Yeah.
So when you
So
came when you came to the U.S., did you notice anything difference between European and American states of the massage field at all?
it was totally different. I'll tell you, I started working here in America as a staff trainer for a physical therapy organization, very huge organization that provided uh, inpatients and outpatient physical therapy. And I was absolutely shocked that massage therapist is not involved in rehabilitation procedures. This is mainly, say, electrical stimulation, ultrasound. It's very important, valuable modalities. But if you're not putting hands, if you're not mobilizing fascia, if you're not mobilizing muscles, if you're not addressing trigger points by spatial ischemic compression, you cannot achieve sustained results. That's why Americans used to, and today they continue, consuming painkillers, sleeping pills, and etc. Yeah.
Yeah, that seems so common and stuff. I mean, painkillers before the actual massage and stuff, and I mean, massages seemed like the last option and stuff.
No, this is absolutely wrong between us, Ryan. This is number one option. Because, for example, now we will talk a little bit on orthopedic massage because you brought to this topic. In cases of sport-related injuries, chronic diseases such as arthritis, degenerative diseases, they all factors that producing pain is tension in fascia, tension in muscles, trigger points, and if not to address them, you will not achieve results, which is less pain, more range of motion, increased functional activities. Yes. Now, this is what happened. The people today go for physical therapy, average 20 treatments, 3 months, they go and go and go. Why? Because the cause we really address. In Los Angeles area, thank God it's a little bit changed. Difficult to find physical rehabilitation department that will not employ massage therapists. Difficult to find. And thank God they're producing results, guys producing results. And again, because we're addressing the cause of the treatment. Therefore, you don't have to take painkillers before treatment. Opposite. You need these clinical symptoms. And little by little, one of the major factors that producing pain is lymphedema, We do little by little lymph drainage to reduce the size of lymphedema, and then we start mobilizing little by little. We do introductory part that increasing threshold of pain. You see, in the beginning, patient come to you, for example, yeah, and you barely can touch because it's very painful. Now, light performances of lymph drainage to reduce lymphedema size already increasing threshold of pain. Little by little, you do introductory part, you increasing threshold, and you really can increase pressure. If you will ask me a question about deep massage, we will talk about this. It's very individual approach, yeah,
Yep.
and accordingly with the threshold, and we can increase in one treatment. We can do much deeper mobilization.
Okay. And what was your position in physical therapy services company then?
Oh, when I came, I was hired as a staff trainer. It was like 100, I believe, 150 physical therapists. This company provided inpatients and outpatients services, physical therapy services, all over the Los Angeles, all hospitals. And I used to provide staff training for physical therapists, especially they were interested in post-isometric relaxation techniques proposed and developed by Czech Republic scientist Karel Levitt. Lately, more in America, people know name of Vladimir Janda. These techniques, and little by little we spoke about comprehensive approach to soft tissue mobilization, which is orthopedic massage, medical massage. And I was the one who insists that physical therapy aid and massage therapists have to attend my workshops, yeah, in my teaching. And this paid off. And also by results, they start achieving better results. Even today, they're achieving better results because they're employing and incorporating in treatment our guys. Yeah. We do measure. This is not a motivational speech, Ryan. I hope you feel and trust me. This is true.
Yep.
We dressing and then exercise. I was the one who screamed until pain on scales from 0 to 2 to 10 will not go to 2. Don't do the exercise. Don't do the exercise. First of all, you see, reduce the symptoms by addressing the causes. Yeah, and then do exercise. And of course, this comprehensive approach, including exercise, is very valuable stuff. Yeah.
Yep. And it seems like orthopedic massage is a real big buzz now in the massage field. Can you expand a little bit more about the modalities that are included in orthopedic massage?
Yeah, absolutely. But Ryan, if you will allow, a few words I will say about my new program on DVD. May I?
Yeah.
Oh, thank you very much. Ryan, look, I decided to, by the way, our mutual friend, David Otto, he inspired me, convention of 2011, Nevada chapter convention. He spoke to reach out to community, medical community, to start getting referrals from them, to work together. And he inspired me to produce this program called Orthopedic Massage, Physical Therapy Aid, and Chiropractor Assistant Program. On this program, I teach myofascial mobilization, which is fascia and muscles mobilization, all modalities of orthopedic massage, including exercise program, utilization of physical therapy equipment, etc. If you will give to audience my website, I will appreciate. They can read about this. They can preview even all this from this program. And thank you for opportunity to introduce, to allow me to tell guys that I have this program, very good program. Yeah, by the way, they will learn a lot.
Yeah.
But coming back to your question, Ryan. Oh, I'm sorry. You want to say something?
No, go ahead.
Oh, yeah. You asked about to expand a little bit more about orthopedic massage modality. This is a comprehensive approach. Like I said, lymphedema is a part of any orthopedic disorders, size producing pain. Tension with fascia, many times myofascial pain can produce significant pain that will cause a lot of pain to people and dysfunction and maybe disability. And MRI will be perfectly good. And people coming, why? Because MRI cannot pick up tension with fascia and muscles, but when we putting our hands, we can kind of feel tension and diagnostic tension within fascia, and to eliminate this tension by mobilization of fascia, and as well to mobilize muscles to eliminate it. Yeah, and due to this, myofascial dysfunction, always secondary, not always. If early we will start treating, probably we will prevent development of trigger points. If not, trigger points will be developed. In such a case, we have to compress it. Now, it's popular, I agree, but I mean, I don't want to criticize what I don't know. Therefore, today I will talk about what I know. I know that we do not have, our body do not carry myofascial tissue. Aligns fascia and muscles. And the crucial for us, in order to achieve results, it is crucial for us to understand that fibers of fascia have no physiological potential to constrict. And muscles, of course, can constrict, and we can contribute to normalization of normal resting tone. Yeah, this difference of this alliance we have to understand. Now, if you would be so kind, we can show even my hands-on demonstration how to mobilize fascia. Is it possible? Right?
Yep. You want me to play that right now?
Yes, please.
Okay. Okay.
Thank you very much.
Yep.
Today, my presentation I will dedicate to myofascial mobilizations and its role in orthopedic massage, treating painful orthopedic disorders, post-event rehabilitative sports massage, extremely important to incorporate myofascial mobilizations, etc. We a lot lately hearing about myofascial pain, mechanical pain, trigger points as a result to these dysfunctions of fascia and muscles, trigger points development. All this kind of cycle today I will not only explain, I will show you what to do. First, the person who proposed mobilization of fascia, connective tissue massage, was Professor Duclay, Austrian physical therapist, Duclay. She actually introduced to us many years ago, probably more than 70 years ago, importance of connective tissue, differential to understand in soft tissue, and this is what massage about, is soft tissue mobilization, to differential the histology data of this tissue, I mean muscles and fascia, etc. Actually, she called it connective tissue massage. Today I will show classic, and it is fascia mobilization massage, connective tissue massage. What is extremely important for us to understand that we don't have myofascial tissue. We have fascia and muscles. Fascia is a connective tissue surrounding muscles, helping transmit power, creating pathways for blood vessels as well, for nerves, but this is connective tissue. Connective tissue fibers have no potential to constrict. And therefore you'll see when I will demonstrate techniques, it's absolutely different techniques. It's different than muscular mobilization. Today I will show you muscular mobilization also, of course. We'll propose different kneading techniques that really mobilizing muscular tissue, but techniques different because of the difference in nature of this tissue, being this connective tissue when fibers cannot react, constrict, and these tensions in fascia is a result of metabolic disturbances. We'll talk lately at the time of hands-on performances. And muscles fibers have potential to constrict, relax, and this reaction of constrictions, many causes. The stress will cause higher resting tone, increase in resting tone, physical load, irritation of spinal nerves or pinch nerve. Yeah, also irritation of the spinal nerve, pinch of this nerve will cause muscles to constrict. Many different causes. Yeah, this fascia, this is process of metabolic disturbances with time, fascia accumulating tension.
So you brought up some important points about the difference between the muscular and the connective tissue. Then
It is. But did our audience had a chance to view my hands-on performances or not yet?
yeah. Or
Oh, they saw how I performed, and the second I just couldn't see on screen.
okay.
And superficial layer and second layer.
Or no, I just the first video I played.
Oh, okay.
Yep.
Let's do. You're the boss.
Okay.
Oh,
you want to?
you know, when you're laughing, I swear it makes so good.
Thanks.
Around
you want me to play? You want me to play the superficial and the deep fascia one?
But just, you know what, let's talk a little bit, and then I would like to our audience, I would like to share my knowledge to see really the difference in hands-on performances. Yeah, you're the boss. What you will tell, I'll do.
Okay.
No, I'm very disciplined.
Okay.
Remember, I come from tyranny, from dictatorship. They
Yeah.
ask you to jump, and you ask how high.
Okay. Okay, so I'll play the next video then. Okay.
Yeah, please. Yeah.
Okay.
Fascia, like I stated, surround muscles. It is one unit with that containing different tissue, absolutely different by nature tissue, muscles and connective tissue and fascia. Fascia have two layers, and Professor Duclair, she proposed this with third and fourth fingers and pull to the sides. It's otherwise impossible to release tension with fascia, but to pull it, just to rub and to pull it, rub and to pull it, rub third, fourth fingers, fold and to pull it. This is actually classic approach to mobilization of superficial fascia. Professor Duclair, she recommended to do it fast, like you rub and fast. Many years since I graduated, it was part of the comprehensive protocol of soft tissue mobilization. Medical massage is a comprehensive, it's a component such as fascia, connective tissue massage, muscular mobilization, trigger points, therapy. It's kind of the combination of techniques that directed to address all these different tissue. Again, many years of experience to do this classic approach. I gave up a little bit. I gave up the classic protocol, but techniques that I will propose to you, of course, you're welcome to try all this. It have to be no lubrication, all these techniques. You're welcome to try classic approach. I just sometimes, because it's fast movement, it can cause intolerant pain. Therefore, in the frame of her proposal, Professor Duclair, I developed it is working well, techniques. For example, here I have to mobilize fascia. I grab the fold and I pull to the side, and I pull to the side. Now, I'm working right now on this area circle, and here it was fold. Now I will, exactly like she proposed to the different direction, what I will do, I will change the angle of this fold, and all this 360 degree, I will work you see, and this is possible to mobilize. Now, it is when somebody is suffering from myofascial dysfunction, myofascial pain or mechanical pain, and this could be terrible pain, this dysfunction is a result of accumulation of tension within fascia and muscles. And it is, for example, if one will complain on this area pain, you like this, in comparison, you will feel restriction here a little bit. You will feel the restrictions, and you will, of course, spend time, you will push. It's absolutely mechanical stretch.
Okay, that ends part one then.
Yeah. Okay. Okay. And let's show have to go on. Yeah?
Okay, part two. Okay.
And you have to laugh more.
Yeah.
I'm positive. You know what? I guarantee you, all your audience love when you laugh.
I hope so.
This I can guarantee.
Okay.
It makes difference.
Yeah.
Most think positive.
Okay, so I'll play
You have
that.
to trademark.
Yeah. Okay, I'll play part two.
It is absolutely must be kind of mechanical pull of this tension. Like, for example, if this towel, you see a lot of, it's kind of not straight, and and this is like fascia, it's like a reversible deformation, it's reversible. You have to take and to pull to this side, 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 and only this way you can release these tensions, because these tensions causing and producing pain, dysfunction, limitation of range of motion. We have to, and of course secondary, we'll talk about this, causing developments of trigger points. And again, I just will show like this, you rubbing, and 1, 2, try to imagine this towel that seconds ago I demonstrated on towel. Absolutely. And all area you walking, where is the localization of pain. Usually in a frame of few treatments, when you will find this restricted area, and this always in a painful region where your client will complain on pain. In few treatments you'll release it. Yeah, but my proposal to you, continue to mobilize. Fascia, you see, there is Society of Connective Tissue Massage. They do no other soft tissue mobilization, and they do reaching some, even deep fascia. I will right now will demonstrate deep fascia mobilization. And they continue to do only connective tissue massage. Not what I agree, it have to be much more for adequate treatment. No, honestly, look what they're doing. For example, if patients complain that here is pain, they're staying in and working like this. And this, to me, nothing else than ischemic compression, which is trigger point therapy techniques. What I'm trying to say that even restriction will be eliminated. I do recommend the other sessions that you will provide with, do just connective tissue. Maybe on this circle you will stay less, but do like other for stimulation of healing process. It's very important. It's also in general affecting body very well. Therefore, to adopt, it's very easy physically to perform. To adopt these techniques, I would recommend. Now, these techniques originally that was proposed by Professor Duclair is very effective for superficial fascia mobilization. Deep fascia second layer, Dr. Chernik, Russian physician, he proposed geniusly, this is the classic. You just stretch and release, stretch and release. And again, if this is the circle, you remember towel, just remember example with towel, we have to pull it to different direction fascia, because this is the only way to pull it out, to straighten it out. Therefore, remember, if I will take this area, which is 360 degrees circle, here is my hands, one, and I will continue like this. You see, I'm in the frame of this circle. And of course, the other area, the same way. I'm a big believer that every one of us in a frame of design protocol can improvise, and therefore I do, but in frame of protocol. I understand the mechanism, I understand the goals, and in a frame of this understanding, in a regional protocol, for example, deep fascia, you can do fist like this, fist like this, if this will be back or other area, this is contact area, like this, and you're doing like a seated, I'm a big believer that in a frame of classic, like Duclair proposed. Brian, can you hear me?
Yeah, I can hear you.
You guys are low. You know what? I appreciate that our audience is so little bit hands-on, and now we can spend time, we can talk, I can explain more. Most important that what I try to talk on orthopedic massage, and especially my facial mobilization, our audience had an opportunity to view, and I would love to continue, if you don't mind, explanation a little bit on orthopedic massage, and whatever you will ask questions.
Oh, that'd be great. Yep.
Yeah.
Yep. So,
Okay.
So have you seen the theory and everything else behind trigger point therapy over the years change some?
Ryan, for example, Professor Prilutsky is also a Russian physician. You have to understand why. I will go a little bit back. You see, Russian Soviet medical and sports massage was a little bit advanced and much more in advance than in other parts of the world because of the Cold War. You know, the only good stuff that happened due to war, Cold War, it still was war, ideological war. Yeah, Russians understood that you Americans, you couldn't come and see how we live our life. You couldn't come. But all of Americans could see Olympian Games, and they saw that most of Olympian gold used to go to Soviet Union, Bulgaria, all these red flags countries. Yeah, and therefore Soviet government understood that the only battlefield where they can win is this Olympian Games and other international competitions. Therefore, tremendous amount of money was invested in sports medicine, and especially rehabilitative efforts by means of medical and orthopedic and sports massage. Professor, and there was rule. You see, if here somebody can come and tell, hey, I developed method. You couldn't say this in Russia. If you develop method, you have to apply it to Institutional Review Board. This is kind of special internationally. By the way, here it's the same. You have to submit protocol, what you will do, what your achievements, what your, the opinion of outcomes. Of course, must be a control group to test against placebo. And you conduct research. And in this research, in the end, medical statistics will be applied and paper will be published. We know right now this is working, not dangerous, and so. Therefore, for example, as a part when trigger points was discussed in details, and I'm talking on end of the 60s, Professor Prilutsky, using isotope and using histological studies in different in electronic microscope, he established that. By the way, Travel and Simmons referring to him, he established the morphology. They repeating, and I'm glad they mentioned this. Morphology of trigger points is ischemia, means blood supply to this pinpoint localization of pain much higher than availability. And therefore, he proposed this trigger point therapy by ischemic compression. You have to really to abstract, and if we will have chance, you will show that. But this is the establishment. It is clinically, most important clinically proven. I know many times I see, and again, upfront my forgiveness, I'm not criticizing. I just want you to reach results. And if you will not compress ischemically, real ischemically will not compress in 2 levels of threshold, you cannot eliminate trigger points. If you will not eliminate trigger points and only inhibit trigger points, adequate results will not happen. It's very important adequately to compress. And I see ischemic compression, some people said you have to do this slide. It's not much. Look, in order to claim that, for example, Prilutsky or other is doing something wrong or proposed wrong, you have to conduct real research and say, you know what, I tried, it's wrong, this is better. And plus, all this new methodology have to be proven clinically that work with time, time of massive utilization. Therefore, yeah, we hear a lot of our guys doing right. I see in social media we're talking, yes, we're compressing like this, ischemic compression and total compression as much as possible. And some calling this trigger point therapy, but it isn't. I'm with what I see, what I hear, I can say, and I can defend. This is kind of constructive criticism. I can defend every my word if I will criticize. Yeah.
Yep.
That's all.
Yeah. and then the whole term medical massage, I mean, some people accept that term and some people don't. Why do you think some people don't accept the term medical massage?
I don't know. There is many different opinions. I'll tell you, Rand, when I come to this country, I taught medical orthopedic massage, including stress management, rehabilitative post-event sports massage, and of course orthopedic massage, big part of it, to treat back and limb disorders, including sports-related injuries. I was trained, and I didn't know other name for massage. This is how I grew up as a professional, that I trained in medical and sports massage as it was proposed by Professor Sherbak, and of course many other scientists contributed there. But the segment reflex massage, the whole idea and mechanism was established by Professor Sherbak, Anatoly Sherbak. Now, I was very innocent, very straightforward, didn't try nothing else than to declare what kind of type of soft tissue mobilization I'm doing. I'm doing medical massage. Oh my God, a lot of people were angry. And I said, guys, I don't know. I'm innocent, you see, not guilty for nothing. I was trained like this, and this way, introducing it, it was a lot of misunderstanding. But today, you see a lot of people calling medical massage. And let me tell you something. Massage therapy, medical massage, or clinical massage, or therapeutical massage means the same. Providing therapy by means of massage. Massage therapy, medical massage. You see, therapy, it's no need already when we say medical massage, but massage therapy. Each of us who providing, my strong belief, it's not an opinion, that each of us who providing therapy with benefits to human being, providing this therapy, performing medical massage, this is your choice. Every one of us, here I'm strongly believe, if you have any discomfort to call what you're doing medical massage, anyway you're calling this medical massage by telling I'm providing massage therapy. This is absolutely the same. The only point, we have to provide therapy and not opposite. And if you're using opportunity, can I criticize a little bit?
Yeah.
Well, yeah. Okay, Ryan, listen. We have to provide therapy, benefits, achieving results in massage therapy. It's too powerful to become traumatized. And I'm talking on deep tissue massage. Deep tissue massage is any type of therapy by means of massage have to include mobilization of deep tissue. It have to. But this doesn't mean that strong, vigorous pressure serving this goal, stimulation of deep tissue. Doesn't mean. It's absolute doesn't mean. Good example, in cases of orthopedic disorders, deep massages must be part. We have to stimulate deep tissue too. But what to do if this threshold so low? You're barely touching, people jumping. Of course, you will start with superficial. You will relax superficial muscles. Little by little, during introductory, it's called pain gate control theory. It's full lecture. Maybe one day I will come back and I will talk about it. You increasing threshold of pain. You can apply a little bit more pressure. You can go a little bit deeper. Of course, deep tissue mobilization feels stronger. But can we apply this vigorous pressure? Now, the same Professor Prilutsky once proposed great definition about pressure and about deep massage. When I started school in 70s, professional schools, all textbooks said, okay, on the SI region, compress 50 pounds. On this, all professors said, ignore the numbers we had to write it. Use your sense of touch. Use this. Professor Prilutsky came out with brilliant, very useful and helpful formula. He said like this: pressure should be significant. And from my experience and from myself, I can tell pressure, yes, have to be very significant, but not to activate pain analyzing system. How will we know that we activate the pain analyzing system? If, for example, I press in protective, and this have to be gradually applied, and muscles protecting, little move. It's really little move. You have to listen to this move, you will find. Otherwise, you will miss. It's little move, and even your client will tell, oh, I can take a lot of pressure. They can take a lot of pressure. They cannot manage our procedure. Absolutely. We do therapy by means of massage in order to achieve results. And when these muscles will jump as a protective phenomenon, go back. Don't continue. If you will continue to press more protective spasm, this is injury, and significant muscular injury. You see, and this all we have to all. Doesn't matter if one call what he does medical massage or orthopedic massage, which is the same, or providing massage therapy, providing therapy by means of massage. We're all doing the same. We're doing medical massage. I just call it, I explain why I call it medical massage, but we're all doing medical massage, but with pressure. Please, with pressure, guys, we have to be, not to confuse general public. You see, you guys selling deep massage, and this costs more money. this is business. I don't know, and I cannot tell this ethical or not ethical. Why? But because any massage have to include deep tissue mobilization. Yeah, but don't make it experience of torture. And this is I see a lot of blames and claims, and we know, and patients have to be educated by us. What is the deep massage? Of course, you will feel deeper. Sometimes it's like anger management. Can you press more? No, I mean this is anger management.
Yep.
And but client, God forbid, if client will pick up, if you will pick up energy of client, angry, overstressed, most of us, all of us, you will pick up, can you press more? You draining yourself, your energy status will be disturbed. You providing no therapy by means of massage, and in many cases you can inflict the injury. They can, yeah, can you more? I can say, of course, we're in a business, in some way, we're in the business of services. Exactly like medical doctors do. Of course, but the patient cannot say to doctor, stick needle deeper, cut the, he cannot. Yeah, the same cannot be with us. But if they ask, it's just my advice, because, I can take more, can you press more? Yes, of course, but little by little I will relax superficial, put a little bit forearm, and compress a bit, just let him know it is a message to subconscious, unconscious level, that yes, I'm strong enough, and any lady who doesn't have my weight, yeah, thank God for this, we can flex a little bit gradually. Yeah, message she can press or he can press. That's what with this angry, you see, overstress, and today it's pandemic, stress exposure and side effects, terrible side effects. People sick from these side effects of stress. This also produces bitterness and anger. And this infliction of pain, so-called deep massage, yeah, it's not a therapy. You see, helping kind of manage this anger. I don't want to use the word manage. Anger to release whatever. And this is also not, manage stress, anger will go down. Yeah. Give them this feeling, but you're professional, no one can tell you how much to press. Press, yes, of course, soft tissue mobilization, when you go to the deeper layers, it feels much stronger, even healing pain, kind of. It's good, muscles not protecting, but yeah, when you compress trigger point, people like it. They say, it's very good, it's pleasant, continue something like this. In this frame, yes. Again, my advice, don't allow to your clients to manage you. If you will pick up their energy, and we do exchange energy in this science, kind of will approve every word what I'm saying. Yeah, it's not good. You control and calm, you making them to pick up, to calm, and therapy and healing and blessings and light. Yeah. It's all meantime.
Yeah.
Go ahead.
And is there a big difference, would you say, with Russian sports massage and sports massage over here?
Listen, shouldn't be. I don't know. What I see, look, when I came to this country, honestly, people taught sport-related injury treatment, and they call this sport massage. It doesn't matter, you will injure yourself playing ball or working at post office. It will be the same sprain, strain, lower back, severe sprain, strain, and other diagnoses. You're applying orthopedic massage in this case. In sports massage, what I trained in, I know very little about what guys calling here sports massage and doing, but by all means, we have actually three types, I believe in two types of sports massage. This is rehabilitation, the side effects of this vigorous practice. And today, if you will go to the gym, you will see people working like they're preparing themselves to Olympic Games. So this is not. You see, it's just kind of preset of mind. And of course, all this hard workout causing these kind of side effects, such as accumulation in tension in muscles, in fascia, which is a precondition to sport-related injuries. It has to be rehabilitated. Therefore, post-event sports massage is to eliminate side effects of this vigorous exercise. We're eliminating it, and we're helping people feeling better and can perform better, and we're preventing developments of muscular pathologies, developments of preconditions for sport-related injuries. This is one, sport massage, but post-event sports massage. And pre-event sports massage. It's a little bit different techniques to prepare people to perform. Just using the opportunity can give advice. Guys, never use, when you do preparation to before athletic activities, never use oil. Use any lotion, any lubrication that excluded oil, emulsions, no oil white. But if you will use some creams or oils or other lubricants that contain oil, you have to wash them well after this. Otherwise, they can overheat, especially with marathon runner. You see, the oil on skin will not allow it to cool down the body, and tragedy can happen. Yeah, the prevent sports massage is a little bit different techniques, different goals. It's preparation, much faster. We're doing like 100 plus movement per minute, and this is called acetylcholine, neurotransmitter spatial. That when we are activating like this, I don't know if on camera people can see it, spatial techniques. It's allowed faster reaction to for muscles and etc. It's different protocol. The number 3 that I less believe is called straining sports massage. In case if somebody is severely injured, such as fracture, and have to be in bed, professional athlete, you kind of stimulating body, and they claiming that is keeping people not to lose so much shape. Maybe I would do and would recommend to do in such case massages, but it's very important for different perspective to circulation. But and I do, but I don't call this strength.
Yeah.
You see? Yeah. Please, Ryan.
Yeah. And what kind of lubrication do you usually use during your treatments?
Oh, you know what? Bruce Belt. Who don't know him? This is your friend in this show, even Von Whittle. Yeah. Look, Brian, I grew up in very poor society. Massage therapy, science of massage was developed very much, but we didn't have these lotions and oils and various of them, and all these creams they competing. We used to, I'll tell you, for lubricant, we used to take a piece of very cheap soap. We used to shred all this, mix with water, and this is the lubricant to prevent skin irritation. Here in America, we have, various. I always used to look for creams and lubricants that will stay enough time that I will have not to minimize this, that I will have an opportunity to minimize this connection. Will enough lubricant will stay, and I will mobilize the issue. Bruce, I know Bruce for a while, for a long time. He contacted me and said, Boris, what if I will send you a gift from me? I will send you some cream. I want you to try on client, and I want your opinion, professional opinion. Don't have to be biased. And this, I said, I'm not capable to give something biased. And he sent to me. It's called jojoba massage cream with jojoba. If correct me if I'm wrong.
Yep.
Cream with jojoba. And I tried, and since then it's already like 7 or 8 months, no more probably. I use only this. It's good. It's not heavy. It's absolutely not heavy. Stay a long time as a lubricant, and I love it. It's allowed me to work how I understand. You see, I teach, I perform to minimize this connection. Of course, when it's already drying, you have to add it, and it's kind of breaking a bit, and I don't like it because I also energetically involved. I cannot. I don't feel comfortable to take more lubrication. And this jojoba cream, it's working. I'm using it. I'm using what you with your company do. I'm using it. It's good. It's good. Jojoba cream. I know you have more others. I'm simple thinking. Bruce sent to me this. I tried. I like it. I said no. He said, "Oh, if I will try to send you, why to waste money? I love it. Better cannot be." Yeah.
Yeah, and what kind of workshops do you offer then?
Pardon me?
What kind of workshops do you offer?
Oh, I practically, Ryan, I can teach 50 plus case conferences. presentations. You see, well, on my DVDs, you know, I produce DVDs. I produce 21 DVDs in total, and I cover like 60 topics, including self mobilization. Varies. I teach deep tissue massage. In August 4th, in my school, I founded a school probably 18 years ago, something like this, a little bit more. It's called South California Health Institute. I'm a founder, and this August 4th, I will teach combination post-event sports massage and stress management massage. Extremely important modalities today to know. Extremely important. I'll tell you, Ryan, last 10 years, and because of this exposure to stress, tremendous exposure to stress, in orthopedic disorders, you cannot achieve results. I can, if you will not incorporate stress management massage, because stress, fueling precondition, this injury, aggravating stress, and of course producing new aches. We have to, today we're fighting a lot, we physical therapists, chiropractors who in fields of physical medicine, we're fighting stress and will be not successful fight if we will not incorporate stress management massage. It's most powerful, all methodologies, including yoga and meditation, which is great. I started doing meditation already for a while. It's all this great. But no methods, and please, guys, can't take it like in America saying to the bank. No method can compete in power of stress elimination, of tension headaches. This whole stress-related phenomenon, temporomandibular J disorders, essential hypertension, anxieties. No method can even close to come to power, to healing power. It's like, you know what, if you will agree, I will come and I will do show on stress management, and I will show and I will recommend. August 4th, I will teach real stress management massage. Today, all of us have to know it. You know what, guys, doctors today overwhelmed. They don't know what to do with these side effects. Statistically, 85% of doctor visits, annual doctor visits, which means millions, is related to stress side effects, such as anxiety, tension, headaches, what I say. Doctor overwhelmed. They don't know, try this medication, failing. Medication cannot take control, but can cause addiction and other side effects. And they looking for us, and we have to perform medical stress management massage. We have to. In August 4th, I will teach medical stress management massage, and I will combine it with post-event rehabilitative techniques. Guys, it's needed modality to know today. People who are working out crazy need this rehabilitation, and of course, stress, like I said, it's pandemic, and we are most powerful. Now, I understand that today financially we all a little bit have difficulties, and therefore, to save time and money, I designed it. I thought how to deliver its methodology of teaching, how to present it, and I will be able in 8 hours to present both modalities. It will be not so difficult because most of side effects of emotional stress and side effects of exercise stress is similar. Muscles, the first factor that reacting on emotional stress, higher resting tone, on physical work, higher resting tone. And therefore, I will teach only the different, what I will teach, this elimination of adhesions. This adhesions is always when somebody working out vigorously, and we're talking on professional athletes, woo, this is kind of side effects of these adhesions. Adhesions have to be eliminated. Only question of time snowball will be around this build up, and of course severe injury. As I said, will be precondition for severe injury, and then fast movement, force coming, and would be significant injury. And only what I will teach additional prevents post-event sports. I'm sorry, not prevent, post-event rehabilitative massage is techniques very easy to do, elimination of adhesions. We have to know it. Yeah.
And
And
what
of course, Opus Force, you guys welcome to join me.
and what can we see from you in the future then? What's your goals and plans and stuff in the next year?
Oh my God! Look, listen, I'm not young man, and in my age, the philosophy of life a little bit changing. Yeah, you would like to be remembered, and I acquired in these 40 years, I acquired huge body of knowledge, and I would love to share. I will teach. I will produce DVDs. This DVD physical orthopedic massage, physical therapy aid, and chiropractor assistant. This is part one. I will produce part two, where it will be craniosacral therapy, but this is European. It's not like in America they're using. This is for biomechanical balance, proposed by a Bulgarian physician, Boris Ivanov, Professor Ivanov. He's an MD, PhD, real physiologist was. I had the privilege to sit in his classes. Absolute genius. Yeah, but these techniques, it's very important today to know these techniques. Of course, post-isometric relaxation. This method is kind of to balance energy inside of muscles. In a lot of cases, when motor trigger points spatially will be developed, this is various junction of muscles and nerve junction. It's only a question of time, and the same muscles will produce different energy, part of muscle mass. And post-isometric relaxation that was proposed by Carl Levitt, working miracles, improving range of motion, all working miracles. I mean, this is great techniques. It's muscle energy work was proposed at the same time. They didn't establish from other by and Dr. Mitchell from Illinois. That's the genius. I have his book. I know his grandson, genius fellow. He was too osteopath. This is the same muscle energy work, but I practice what Carl Levitt taught. This is my plans. And you know what? If you would like to have me again on your show, this is my plan, to come and to talk to you and to share my knowledge.
Oh, I'd love to. Yep. And then what's the best way for people to get a hold of you directly then?
They can, I don't know if you can put in screen, they can write direct to me, borismedmassage@yahoo.com.
Okay.
People welcome to visit my website, medicalmassage-edu.com. A lot of articles, a lot of free lessons, example, on my Facebook page, my managing company, they put for previous, soon they will take probably out. You can all 3.5, almost 4 hours to view all my performances of physical therapy aid, orthopedic massage, including exercise, including all what containing that. Yeah, this is a lot. Look, I don't want to overwhelm our audience. I'm overwhelmed. Yeah, I'm still old but passion person. I passionately love this situation. This is true. Passionately love this situation. Yeah, and people can go to write me email or support@medicalmassage-edu.com. This email also will be forwarded to me.
Okay, perfect. And your YouTube channel is just amazing too.
There's a lot. Yeah, you're my main competitor.
Yo.
You have like a dozen thousands. I have only 400.
Yeah. Yeah. Well, thank you very much, Boris.
You're a great man.
Yeah.
No, it's a pleasure to talk and trademark your laugh.
Okay.
For opportunity to talk to you, to hear your laugh.
Okay.
Very good, very spiritual, very human.
Thanks. Thanks. And thanks everybody for tuning in.